The effects of antibiotics, how postbiotics can help to preserve gut microbiota diversity. As we all know, antibiotics are one of the most widely prescribed medications around the world since they are highly effective at treating bacterial infections. But they do not just kill the disease-causing bacteria, they will also kill beneficial bacteria within our microbiota. Broad-spectrum antibiotics are one of the worst responsible. They kill a wide range of bacteria that are vital in treating many infections, but they also significantly and rapidly reduce microbiota richness and diversity, resulting in alterations called dysbiosis. This can produce some of the most common side effects associated with antibiotics. These unpleasant side effects include gastrointestinal disorders such as diarrhea. It's hard to believe, but up to 49% of people taking antibiotics will develop antibiotic-associated diarrhea. Of greater concern is the fact that this can increase the risk of Clostridioides difficile infection, which can cause chronic recurrent infections and potentially lethal pseudomembranous colitis. As if that wasn't bad enough, the microbiome alterations can also result in an increased susceptibility to infections, compromised immune homeostasis, and deregulated metabolism. Can you believe that following a course of antibiotics, the intestinal microbiome can take years to recover? The impact of microbiota alterations is of particular concern in infants and children. This is particularly worrying since this age group experiences bacterial infections more often than adults, leading to frequent antibiotic use. Studies have actually shown that children treated with antibiotics have significantly reduced intestinal microbiota diversity and less stable microbiota communities. Frighteningly, it has even been suggested that these changes could be definitive. To add insult to injury, exposure to antibiotics during the neonatal period can impair growth, and exposure later in childhood can increase a child's body mass index. Postbiotics, the empowerment of your digestive health. Lacteal is a postbiotic composed of stabilized, heat-treated Lactobacillus lb and metabolite-enriched culture medium. Lacteal stimulates the growth of the naturally present beneficial bacteria, thus helping to restore and rebalance the intestinal microbiota. It's good to know that bacteria being inanimate, Lacteal can be prescribed at the same time as antibiotics without loss of efficacy to help restore the intestinal microbiota and prevent antibiotic-associated diarrhea. When prescribing an antibiotic, pair it with the postbiotic pioneer, Lacteal. Lacteal, designed naturally for peaceful intestines. Postbiotic pioneer in digestive health.